Welcome back to Tales from the Lab, a veterinary podcast. As you may have noticed, we've made some exciting changes around here. I am your new co-host, Dr. Brad Ryan, Senior Professional Services Veterinarian at Antech Diagnostics.
And I'm Dr. Holly Brown, a clinical pathologist and Chief Veterinary Educator at Antech. Together, we'll be discussing real patients and bring in expert guests to offer deeper insights into the laboratory diagnostics used to solve interesting and challenging cases.
Tales from the Lab is a production of Antech Diagnostics. The intent of this podcast is to provide education and guidance with the understanding that any diagnostic testing and treatment decisions are ultimately at the discretion of the attending veterinarian within the established veterinarian-patient-client relationship.
Just a quick note before we jump into today's episode. Our guest today is Dr. Michelle Evason, who is employed by Antech. We are sharing this so you have full transparency about the relationships involved.
Welcome back to another episode of Tales from the Lab, a veterinary podcast. I'm Dr. Brad Ryan, Senior Professional Services Veterinarian at Antech. Today, we're talking about what millions of fecal PCR tests are quietly telling us about parasites we can't afford to miss. Things like Echinococcus tapeworms and drug-resistant hookworms. If you've ever wondered whether just a fecal really changes anything, this episode is for you. Dr. Michelle Evason is the Global Director of Clinical Education at Antech and a leading voice in small animal internal medicine, parasitology, and One Health. She's the corresponding author on several recent peer-reviewed publications using data from Antech's KeyScreen GI Parasite PCR panel, looking at everything from Echinococcus tapeworms in dogs and cats to emerging multidrug resistance in hookworms, and a whole lot more. Michelle, thanks so much for coming on the show again. It's good to have you back.
Oh, it's always such a pleasure to be here with yourself and Holly. Thanks to the team. You guys do such a wonderful job.
We really appreciate it. And, it feels like every time I turn around, you're sharing new KeyScreen data with us. And so let's just start. I mean, you're so busy. How many studies have you, ballpark, do you think you've published in the last couple of years?
Oh, that's hard to put a number on, because one of the really, really exciting parts about it, and of course you led with this, Brad, so thank you, is it really is about collaboration. And one of the really wonderful things that has happened with KeyScreen, and as we know, we're at over 5 million tests at this point on dogs and cats, which is super exciting. And one of the best things that myself and also the head of R&D at Antech, Dr. Christian Lutenegger, and also parasitologist Pablo Jimenez Castro, what we really love to do when we get all these samples, and I always pause here and say thank you to veterinarians in the United States and Canada, because without their sending in these fecal samples, most often for wellness screening, we couldn't take all of that information and turn it into data that veterinarians actually need. And we take it very seriously that we need to turn around and give that back to the profession so that it informs clinical decision making going further. So when you ask me that question, Brad, and I've already broken my number one rule of today, which was be succinct. I was like, Evason, be succinct. But
that's what editors
hard.
are for.
Yeah, it's really hard to be, because at this point, my estimate would be that we're well over 30 publications on KeyScreen test results that we've received. And then when we start thinking about the publications and also research abstracts that we've done with collaborators in the United States and Canada, places like Colorado State, the Ontario Veterinary College, Penn State as well. And I know I'm forgetting people, so please forgive me. But that's what really makes me excited is when people from outside Antech also take a look at our data and our work, and also join together with us to put that out. And I think that's when things become really powerful. And I'm also really proud. The last thing and then I promise I will get back to that Evason be succinct line, is I'm really proud that the bulk of the publications that we've put out on KeyScreen, our KeyScreen GI Parasite PCR test, are clinically focused. So we do have some publications, especially at the beginning, that were very much about performance validation. But these days, most of the time, it's about giving back to clinicians so that they can make decisions on things like risk factors for certain parasites, where we're finding them in brand new areas they're cropping up, and also information on some of the things that we thought were common, but we're learning things, of course, as we go along.
Michelle, we're going to get more granular as we go along, but I do want to start big picture. And from your point of view, 30,000-foot view, what are the biggest aha moments you've taken away from looking at these now 5 million and counting key screen GI parasite PCR results across North America, especially in terms of the One Health risk for people, pets, and wildlife? You know, as a public health veterinarian, I always have to go there with you because this world is changing fast and it has broad implications that sometimes we're not always thinking about when we're looking at that one patient on our exam room table. But let's go like really broad with this and tell me what you're seeing.
No, I love it, Brad. And part of the reason, of course, for that is because, of course, we are speaking the same language, and that language is One Health, right? That intersection between animals, right? People, the two legs I usually refer to them as, and then of course the environment. And I love that you started that question. I mean, I love how you do the podcast in general, but I love that you started with a big picture type question, because that's actually the approach that we've taken all along with Keyscreen is, and you know, I bluntly, we've received some criticism on that front, right? Because one of the things that's been very important to myself, as well as Dr. Christian Lutnager, is really to be looking at this as One Health. And so the things that we focused on in the beginning was staying committed to that messaging. And so the earlier publications that we put out were really focused on One Health as well as antimicrobial resistance. And so the earlier publications and some of the ahas were around hookworm resistance. And I feel really proud of those early publications that, you know, the very first one that Christian put out with his team, the validation of the 167Y for hookworm benzimidazole resistance marker, as well as the later ones that came out sort of broadening the cases that we were finding of dogs detecting for benzimidazole hookworm drug resistance in the United States and Canada. Because although we were just learning that hookworm drug resistance was a problem, we really didn't know how much of a problem it was. And so it was really exciting to, one, validate a test to help veterinarians diagnose, detect, and then make appropriate antimicrobial stewardship type decisions, so mindful antimicrobial use on those cases. But probably for me, the biggest aha part of that one was it's not just in greyhounds. It's not just in Florida. And so we got to be, I mean, I'm a geeky infectious disease small animal internist, right? I'm proud to be part of the Canadian infectious disease mafia, which we affectionately call it. And so being part of something that broke that was incredible, right? So a proud moment for me for my career, and I got to do it with some of my very favorite collaborators. And so we let veterinarians know in a peer-reviewed publication that we were finding hookworm resistance in dogs that had not traveled to the United States and Canada. Right. And so we also found cases in dogs, so detect results in dogs, not just in Florida, but all throughout the United States. So in areas where we really hadn't seen that reported before. Anecdotally, veterinarians were telling us that they were finding that. And that's really powerful information. But as veterinarians, of course, we're always the show me the paper, show me the publication. And so being able to be part of, hey, we're showing you the paper because you guys, our largest collaborators, right? The veterinarians that do the screening tests and send us those samples, we were able to give that back and say, hey, all that stuff that you've been telling us about how you are finding these dogs where you just can't get rid of that hookworm, well, here's why. Right? Because it's not just in greyhounds, right? We found it in over 70 different dog breeds. We found it all different ages. We found it all throughout the United States in different states. And again, we also found it in Canada. And we've been part of detecting it in Brazil because, of course, my position is global and Antech is also a global company. So we've also been detecting that in other parts of the world where, again, we didn't think we were going to find it, but that's kind of the good news, bad news things about being an infectious disease geek is you are always like, it's never going to be there. And then you find it. right? So that one was probably one of the bigger ahas for me. And of course, huge public health significance, because drug resistance for hookworms has implications for humans as well, because of course, that's a zoonotic concern, and the same drugs are used for treatment. And so being able to highlight that and stay true to that One Health messaging was really impactful and a big aha, probably the earliest aha for me, if I'm being honest on that one.
Yeah. Well, when you overlay what we're seeing with GI parasites on broader trends like climate change, land use change, pet travel, what patterns are emerging that practicing veterinarians really need to have on their radar right now?
Yeah, and I think probably the biggest thing, and this is, when I describe my position to people, I'm often saying what I do is raise awareness. And so I love that question too, because, we started off talking about hookworms and hookworm resistance. And so raising awareness around that and needing to run the test to find those things, especially on those patients that seem to be refractory to treatment. And then other things like, and these again have big One Health implications, are GI parasites that Keyscreen can detect that aren't able to be detected commercially easily by others. And so the ones that come to mind, of course, are Echinococcus multilocularis and Balis ascaris procyanus would be another two for me that are big. And as you know, I could talk about Echinococcus multilocularis for quite a long time.
I have more questions about it, so you'll get a chance to do that. I promise. We weren't going to leave that one
I hope
under the
not.
stone. No, we're going to
Because
turn that stone over.
yeah, what I also say, and what I did say a lot in 2025 as we come to a close, is if I do one thing in my position this year with respect to GI parasites, it will be to raise awareness around Echinococcus multilocularis.
Yeah. Yeah, it's a very I mean that's been the most jarring, I think, for
Is that
me.
your aha?
Well, it is. I mean, and I mean, I know that nature is always telling a different story than what we can find in the peer-reviewed literature. That we're always catching up, right? I mean, that's the nature of research. It's happening, and we have to figure that out. We have to do that detective work. But Echinococcus is, like you said, I think we spoke about this the first time I interviewed you. But there are some gnarly zoonotic diseases on this panel that, for many veterinarians, because they're not, like you said, it's not part of our routine conversation. So we've sort of maybe lost sight of the ball there. And yet when we do comprehensive screening across North America, eventually we're learning a new story about what might be going on in our backyards, right?
Yeah, and it's kind of a funny thing, right? Like I often say this, like evolution of your career, things that you reflect on as you move along. And I think about myself going through veterinary school and also doing my residency in small animal internal medicine. And we just, and I think it's a funny thing because until recently, and in leading infectious disease textbooks, GI parasites weren't included, right? And I know myself that they were not a big focus of my residency training. It was kind of a leave that to the general practitioners. And I think it's been really fascinating and a little bit humbling for me to learn as much as I have about GI parasites since I joined Antech 3+ years ago, because I've had to dig deep. And I think, again, seeing these results roll in and being able to put these data sets together and turn them into publications and be part of that has really helped me be more of an advocate for general practitioners and the screening that they do every day. And you already heard me say thank you, and so I'll say it again. What we can learn, and and it's a levels of risk thing too. Like many of the GI parasites that are detected, I mean, Keyscreen's really big. It's 20 GI parasites on there, and many of the GI parasites that we detect with that panel are zoonotic. But there's also levels of zoonotic risk and disease concern, right? And so I think many veterinarians, general practitioners, again, thank you, are used to talking about zoonotic risk as associated with roundworms and also other tapeworms, But then you move to something like Echinococcus multilocularis, and the level of risk associated with that particular parasite is considerably different and considerably higher than talking about roundworms, right? Like that's a message that I think most veterinarians are comfortable talking and sharing with clients. But when it gets to something like Echinococcus multilocularis or Balis ascaris, the disease that can result from human infection with those parasites, it can be awful, can be devastating. And so trying to have those conversations and support veterinarians as they do with peer-reviewed publications and also with some of the clinical decision-making algorithms that we've put together, I find that really rewarding. And it's great these days to go and give lectures and ask questions like, how many of you have heard of Echinococcus multilocularis? And when I first started saying that, almost no hands went up. But at a recent set of lectures that I did, we were at about 50% of the hands going up. And so, right. And that's obviously not all me. That's other collaborators getting out there and messaging. And it really is all of us, as you say.
Yeah. Well, I'm giggling to myself because I'm thinking this conversation isn't really all that different than what happens when you and I have dinner at a conference. We like talking about Echinococcus. Yeah. And so I want to start by having you walk us through the Calgary stray cat case where key screen detected Echinococcus. Yeah, she's laughing. I knew it. So key screen detected Echinococcus multilocularis along with other pathogens in this stray cat in Calgary. So why is this such a landmark case, in your opinion, for feline medicine and public health? And what does it say about our gaps in routine fecal screening for cats?
Well, it's a pretty loaded question, Brad, because I think it's one of those. No, it's perfect actually. But now it's my turn to smile a bit because, I think about big gaps with felines, and I think preventive care is probably the biggest gap, and I think that's getting better. But I think all of us, and as cat owners as well as veterinarians, are kind of constantly advocating for cats to get routine preventive care, which includes fecal screening. I'm also, I always want to mention too, with respect to the publications, and I'm sure we'll provide a list of those as well. But that is one that we worked very hard to turn into a publication right away, because again, it's about awareness, and Echinococcus multilocularis in cats was, I don't think, on anyone's radar that could even be a thing. And if you read the publication, you can find out a little bit more about that story. But it was also a call out for cats receiving preventive care in general and being seen by veterinarians. And so Romeo is the cat's name, and of course and everyone can relate to this story, one of these stray barn cats that had some intermittent diarrhea. And so the rescue organization brought Romeo in to see a veterinarian who ran a single test, which was key screen. And that test result came back. Not too surprisingly, Romeo had co-infections with multiple GI parasites, but probably the one that caused the veterinarian to sit up straight when that report came across was the Echinococcus multilocularis detect. Here at Antech, one of the things that we instituted early after we released Key Screen was a system for reporting when we had test results of high zoonotic concern, like Echinococcus multilocularis. And so Lisa Langsrund, who is the lead author on that particular publication, she contacted the veterinarian to immediately have a conversation about the test result that was detected for Echinococcus multilocularis in Romeo, so that they could get clear on zoonotic risk for the veterinary team, anyone that was in contact, as well as the rescue organization, along with the broader community, right? This is also one of these ones where there's a partnership between public health. And so even though Echinococcus multilocularis is not reported in that particular province, still reached out to the public health, the provincial veterinarian, to inform them, because of course that has community implications as well for that particular detected result. And then of course practically wanted to get Romeo started on appropriate treatment, praziquantel, right away. It was also an interesting one too, because of course, like, there's not a a lot of information clinically on what to do with a cat that's detected for Echinococcus multilocularis, because prior to this case being detected, there were just necropsy cats that had been found with this before. So again, a great example of what we can do here, and what I'm so proud to be a collaborator on is taking these test results that veterinarians trust us with, and getting that information back out to the broader veterinary community ASAP. It's also part of the reason why for publications like that, we really target the open access journals. So shout out to JAVMA AJVR for helping us get that one out. And of course, that journal was chosen because it's one that most clinicians are likely to pick up and look at. And that's the group that we wanted to inform, of course.
So let's pivot to another publication on Echinococcus multilocularis. This time I want to talk about your case series of 26 dogs with Echinococcus multilocularis, which showed detection in some novel U.S. states where we haven't seen it before, and often in pets presented for routine wellness fecals rather than having any type of severe clinical signs. So how should that change which dogs we test with fecal PCR, in your opinion? Or is it, that's not really the, it doesn't really matter if they're sick or not is the point, right?
So I think there's a couple things in there, Brad, and I think that, you were asking me before about aha moments, and I think that was one of the other ones for me, because again, it was a parasite that I think for a long time folks would say, it's just confined to like bush Alaska or
Right.
focal parts of Canada. And so we don't need to worry about this. I had to really learn a lot about Echinococcus multilocularis, because there were things for me that I think probably a lot of veterinarians don't know either, which is you really do need PCR, right? Because you can find Taenia, but you can't differentiate Taenia from Echinococcus. So you really need PCR to do that. You can't do that by a fecal flotation and looking through the microscope. So you really do need PCR to differentiate them. I think the other thing about that particular parasite is that a lot of veterinarians don't know is that the eggs are really like ticking time bombs, right? So they're environmentally resistant and they're immediately infective. And that's why prompt detection with PCR is so integral, because we really need to decrease human health risk and risk to other animals. We really need to treat those pets with praziquantel promptly. I think the other thing that I'll mention too is that fecal flotation is not the most sensitive test for picking up Taenia, tapeworms, in general. And so PCR is very helpful in that setting. And that's one of the things that we showed in that 26 dog paper. And so I know a lot of people like yourself too. And certainly it's an important finding, really focused on, we found it in these states that we didn't know we were going to detect it. But I think the other thing for me was when we looked at PCR detection compared to fecal flotation for picking up Taenia, we really found that fecal flotation was not that great, right? And so it was like around 50% of them that we actually found it in fecal flotation, and that's fecal flotation done at a reference lab. So again, not where it should be as compared to PCR for a number of reasons. I think the other aspect of that too is again, it does need to be on veterinarians' radars, and most of the dogs that we found it in were not sick, right? And so, when we talk about enteric echinococcosis, again, most of those dogs don't show clinical signs, and we thought that, but there was a subset of dogs, almost half of them, that actually did have GI signs, usually diarrhea. So really changed a lot of how we think about it. So we should be thinking about it in dogs with diarrhea, and we should also be thinking about it when we're screening well pets. And of course, those dogs that were well were all across the age and breed spectrum. So, we had small breed dogs, we had large breed dogs. And we had dogs from a lot of different states, as you mentioned, where we didn't think that we had Echinococcus multilocularis, and that's mirrored with some of the wildlife research that's been going on and some of our other collaborators, which leads me to another publication that just came out led by Dr. Justin Brown's group in Pennsylvania, which has a huge list of collaborators, and again looked at and detected Echinococcus multilocularis in Pennsylvania in wild dogs as well as domestic ones. And it's great to see these publications that start and then build off of each other, because that's really what collaboration is.
So for all the general practitioners who are listening to us right now, when they get that key screen result back with Echinococcus multilocularis, or another one that we haven't really dived into yet is Balis ascaris procyanus, the raccoon roundworm. So what are the first 24 to 48 hour priorities in your opinion, both medically for the pet and also in terms of counseling the family, thinking about other pets in the household? And then of course, we also are going to have to loop in, especially in the case of Echinococcus multilocularis, we're going to have to loop in public health professionals, right? Because once again, we keep talking about the public health implications broadly, but we're talking about potentially a deadly parasite here, right? And having cysts in your lungs, in your liver, vital organs. This is not a small matter.
No, and I appreciate you bringing that up, Brad, because one of the things that I sometimes forget is, and I make assumptions on what we know. And so when we talk about Echinococcus multilocularis, you're absolutely right. Part of the reason that we are making a big deal about it, I'm making a big deal about it now, is because it's not a parasite that anyone wants to get. One of my long-standing jokes when I'm very kindly invited to speak at parasitology meetings is to ask the parasitologist, would you rather have Balis ascaris or would you rather have Echinococcus? And I kind of laugh because, when we talk about Balis ascaris, we're like, would you rather have, although rare, a neurologic condition, which you may not recover from, or would you rather have cysts in your liver or your lungs or other organs that in some ways is worse than having cancer because they're not very amenable to treatment? Oftentimes people will have them present for, in some cases, 10 to 15 years or more without that being recognized. And it can be very, very hard to treat. And the drug that is used to treat it is not very fun for simplification's sake. So I think that's an important shout out.
I saw a case study where a woman had to have an entire lung lobectomy. And then, of course, we're talking a decade of intense follow-up to see if there's any seeding into other parts of the thoracic cavity.
Yeah, and I think the other thing about it too, is when we talk about Echinococcus multilocularis and how we're detecting it in dogs through the publications that you mentioned. Although, I sort of smile a bit now because when that publication came out, we had the 26 dogs, but we're well over double that number now, and the number of states that we've detected Echinococcus multilocularis in. There's a huge range of those. And so we've detected it in California now, as well as Florida, although we do know that particular dog had a travel history. So again, as time passes, and every year we're leading up to VMX in Western, but every year, Dr. Christian Lutenegger, at my request, I say, Christian, can you make me a new map? And so every year he makes me a new map, sometimes several times a year, because, data sometimes comes in fits and spurts. And we put that map up so that veterinarians understand where we're finding it. And so if they weren't thinking about it before, they're thinking about it now.
So earlier in the podcast, at the beginning of this episode, we were talking about hookworms. Initially, our initial publications were focused on the first benzimidazole resistance marker that we were screening for, which was the F167Y, single nucleotide polymorphism. Of course, now we have added Q134H, which means that our initial estimates were underestimates in all likelihood, because we were only looking at one of the two markers that are now included on the panel. But if we can just go back just to the beginning a little bit, in that large risk factor study on ankylostoma infections and the F167Y benzimidazole resistance marker, you looked at more than 880,000, I believe, dog samples. And what did you learn about who is actually at risk? If we were going to break that down by region, perhaps if we want to look at age of pet, neuter status, breed, We've talked a little bit about the greyhound tunnel vision that some veterinarians have, because that's really where it started, and that was the bulk of the cases that some veterinarians saw initially. So what surprised you most about those patterns?
I am very rarely surprised these days,
Okay.
in part because I've had a lengthy career, if you will. There's some silver in my hair, is what is the line that I typically use. And so and also because I try to listen when veterinarians tell me things. And so I wasn't too terribly surprised that we found those dogs. I think one of the things that was interesting to me in those publications, and we've had a number of hookworm publications at this point. The first one that you mentioned, the 167Y, which was actually one of the first key screen publications. But Pablo Jimenez Castro recently led a study where we dug a bit deeper into risk factors as related to hookworm detection, as well as looking at the risk factor analysis for the things that you mentioned, like age and breed, that we were finding in the earlier publications, because that's what you do, right? You build on research, or you hope that you can. And I think one of the things that for me was a big eye opener was finding hookworm benzimidazole resistance marker detection in young dogs, right? And so that, we talk about and we make recommendations around fecal screening as led by groups like CAPC or AHA, or in Canada, the Canadian Parasite Expert Council. And we talk about for adult dogs, twice a year optimally, more if there are risk factors that lead to them that needing to be tested more than that. And then we think about puppies and in them needing to have more fecal testing done, and particularly true when we know that we're finding more hookworm resistant detections in that less than 1 year of age group, right? And so really needing to look at those dogs really closely. And a lot of veterinarians are running Key Screen as their fecal screening test right now. But for those that aren't, if you are picking up hookworms on your fecal flotations or fecal antigen testing or whatever test works best for you, because I never tell veterinarians what tests to run, right? Because there's a lot of complexities that go into their decision making, right? And I talk a lot about spectrum of care and contextualizing spectrum of care. And that really means reaching that shared decision with the pet owner and taking into account the practice, the pet. And that actually is reflected in what diagnostics they choose as well. But I guess what I will say is if your clinic or you are not doing a PCR as a screening test and you are getting hookworms that don't seem to be going away, you may wish to consider reaching out for a PCR test just to pick up co-infections more effectively, as we showed with another of the earlier Key Screen publications where we looked at PCR as compared to fecal flotation, right, to get at that information for veterinarians so they could use that when they're picking their tests, but also really thinking about running that test in that younger age cohort, right? So again, is it drug resistance that particular puppy might have, which is why they're not responding? Because what's hard, of course, is as that dog is pooping out more drug resistant hookworms, it is seeding the environment, and it is leading to what we found in the earlier publications, which is hookworm resistance in areas that we didn't expect. And so I always say you can find hookworm resistance everywhere in the United States and Canada at this point, because I really do believe that. Yeah. I mean, once that Canadian publication came out, I was like, okay, and it's there.
Yeah, because it is. I mean, that's what we've always been told, right? It's a hot, humid, sort of. It's a parasite that prefers those hot, humid, more tropical, if you will, environments. But no, it's not that simple.
No, and as we know, things change. There's climate change. There's a whole host of reasons why that's no longer the case. But things have changed, and it's great to be able to have a diagnostic with samples that we can then turn around and turn into publications so that we have awareness around what's changed. So veterinarians know what tests are risk to reach for, and also which groups of dogs or cats, depending what parasites we're talking about, may be more at risk, right? And to have those conversations with pet owners to help guide decision making. And then I'd be very remiss if I didn't mention our Antech consultation service, because, of course, as we both know, they talk to over 800 veterinarians a day, and a lot of those conversations are around questions just like this, like the one that you asked me, right? If I'm thinking about hookworm resistance, are there certain groups that are more likely to have hookworm resistance as compared to others? When should I be making those choices?
Would you like to elaborate any on the addition of that Q134H marker? What did that has meant for the panel as a whole, and your thoughts on how prevalent this is and how fast this particular isolate of hookworm is spreading across North America?
Well, I think we've already asked and answered the how fast is it spreading, right? Like
Okay.
from the earlier publications where it was I think we think there is hookworm resistance in dogs, in greyhounds, we're finding it, to where we are now. That's less than a decade, right? Like that's happening very quickly. So we know that not only is hookworm resistance a concern, but it's a concern for the United States, for Canada, for the average dog, right? Like when I talk about hookworm resistance and I ask who's seen a case of hookworm resistance, it is not a single time where no one puts up their hand. And depending on what region I'm in or what group I'm speaking to, whether it's a specialist level conference, because they get a lot of those, I just can't get rid of this, or a general practitioner conference in the southern US, but even some hotspots in various places. Like again, a lot of hands are going up, and these cases are tough to treat. I think adding that marker really speaks to how nimble Antech's R&D, as led by Dr. Christian Leutenegger, has been, more than anything, because not only was Antech able to build a molecular diagnostic panel, which I always mention is affordably priced, right? Because again, I talk about spectrum of care, and cost is certainly one of those things that we have as part of that, along with other things. It also has a really rapid turnaround time. And so veterinarians can be getting answers on those cases really, really quickly.
I wanted to also touch on Balis ascaris a little bit more before we move on, because I live in the upper Midwest, as you know, and I've seen your maps. Um, I love that the eyes are always a lot wider in Michigan and Ohio than some of the other corners of the country. And I think it's interesting. I'm always curious because we name a it's hard. I'm hard pressed to think of a region of the country that doesn't have raccoons. And so we know that there are some difficulties. You have to be pretty astute to distinguish those roundworm eggs from other common roundworms that we see in our small animal species. So I just want you to, if you don't mind, just spend a few minutes telling us what your thoughts are on that, and have you been illuminated at all through the research that you've been doing about the prevalence of Balis ascaris. And we've already talked about the fact that we have some potential deadly zoonotic potential there, and as veterinary professionals, we're dealing with these biological materials on a daily basis. So the fact that we work in this occupation, that is in itself a risk factor, or an increased risk factor for zoonotic exposure. So just have at it, Michelle. Let's talk about raccoon roundworms for a second. I love this one.
Yeah, it's kind of one of those parasites you love to hate, right? Like, I mean, I think, and I always start with I'm a geeky infectious disease person, because I know my reaction to this may not be the same as a general practitioner who runs a key screen and gets a Balis ascaris test result back, right? Because again, as we mentioned earlier, comfortable talking about risk as associated with roundworms in general. Watch your hands, don't play with poop, be aware of these concerns, ask questions in and around immunocompromise, because certainly, as we've talked about, those YOPI groups, so young, older, pregnant, immunocompromised, are always going to be higher risk from some of these zoonotic parasites. I feel like as a profession, we've kind of got this when it comes to having those conversations around roundworms. But then when you talk about a parasite like Bacillus ascaris, and you talk about how, although again rare, so not common to cause disease in humans, but because disease is so severe, i.e., as we mentioned before, neurologic signs which may or may not be treatable or curable, it's a very different conversation to have, and that can be scary and intimidating. And so we really work to try to support veterinarians around that. And one of the best ways we can is, here's where risk is at. And Bacillus ascaris procyanus is definitely one of those ones where, test positives or detection is a lot broader than we used to think. And it's, again, another example of how research can build on each other, because we presented, I think it was back in, was it 2022, 2023? The first set, yes, 2022 was the first ACVIM abstract that we had with one of those maps where you're like, I've seen those maps. And so that was the first time that, Christian presented and he and I put together these to show veterinarians. And one of the biggest findings for veterinarians, and we went on to the annual parasitology conference after that in 2022, was exactly that. Oh, you're finding Bacillus ascaris there, and you can find it everywhere in the United States as well as in Canada. We excitingly have been able to collaborate with other groups. And so we've had a couple publications come out where we've been collaborators, and we actually had a resident that we were working with from VCA that presented an abstract at ACVIM this year on Bacillus ascaris. And she was able to not just dig into the detection, so the test positives that we were finding and where, which is interesting, but also some of the dog level factors associated with those detected results. And so I'm looking forward to when that publication comes out, because again, science evolves, and it's a really wonderful thing to be able to give back. Plus, I like working with residents. It's fun.
Lovely. The last wave of questions that I have for you are really centered around diagnostics in terms of stewardship and day-to-day practice decisions. So we've already alluded to this a little bit about the limitations of fecal flotation, but many clinics are still leaning heavily on fecal flotation, even though we know, as you've stated before, like Taenia eggs cannot reliably be differentiated from Echinococcus. We know that on flotation, that it's on flotation.
Right? Like that's right. One of those ones where it's a like, I'm Canadian, so I'm always going to stick the probably in the I'm sorry in there. But in this case, it's kind of a hard no. You can't tell the difference. No matter how skilled you are, you just cannot tell the difference between Taenia and Echinococcus. With Bacillus ascaris, if you got some skills, you can probably tell the difference from it in other roundworms. But it's hard, right? Like I wouldn't be able to do it, and even parasitologists will confess that it takes them some time. So that's hard to do in a clinic, and of course in a clinic you got to decide how you want to spend your time. But I'm sorry, Brad.
No, don't. And coccidia is another one, right? We have Eimeria and we have Cystoisospora on there. Yes, in theory, if you had the right training and you were really astute, you could tell those apart. But for most of the veterinarians that I've met and most of the veterinary technicians that I've met, and I'll put myself in the same category, no judgment there. I'm not there. And calling it just coccidia is not really, that's not the diagnosis.
No, and it's part of the reason that one of the first publications that we had, 2023, was the comparative study of PCR panel and centrifugal flotation for detection of GI parasites in fecal samples from dogs and cats in the US, because I think that's a hard one, right? Like, as a veterinarian, you get into a routine. We've always done it this way. We run fecal flotations. Hopefully they're centrifugal flotations if you're running them in the clinic. And of course, that's what will happen if you send things into the reference lab like at Antech. But you get into a habit. This is what we do with our fecal samples. And so we really wanted to have a study that looked at, okay, this is what happens when you run a centrifugal flotation fecal sample at a reference lab and compare that to PCR, so that veterinarians had that. And of course, veterinarians can go look at that publication, but PCR, not too surprisingly, is overall much more sensitive.
We're not telling anybody what to do, right? In terms of, this is the go-to necessarily, but it's hard to dispute the fact that when you look at the litany of pieces of information that you're getting off of this test, especially in an ever-evolving world, there's a lot of peace of mind that we can have that would not be provided with other methodologies. Is that fair?
It is. And I guess the other thing, of course, is that, key screen, and you guys can edit this out if you want, but I always say it's a big panel, right? There's 20 GI parasites on there, along with 2 markers. One that we've talked about already for benzimidazole hookworm drug resistance, and also the marker for zoonotic assemblage giardia, so assemblages A and B. So that's a lot of information. It's a very comprehensive test, and it's intended to be run affordably. It's intended for screening. It's intended to be in line with One Health goals that we have. And I think your original question was in and around antimicrobial stewardship. It's also partly what makes me proud to have KeyScreen as part of publications and recommendations by groups like the Hookworm Task Force guidelines, because again, we all want the same thing, which is for veterinarians to have information so that they can make the decisions that are right for them and that particular pet owner. And without information, which often comes in the form of peer-reviewed publications or research abstracts, it's tough to make decisions on what test is right for this particular setting, this pet owner, and this pet. And so we try pretty hard to provide that to them, and again, be really clear that we're doing so with that One Health goal and antimicrobial stewardship in mind.
So looking ahead, this is where I get nosy. What are the next research questions you're hoping to answer with the KeyScreen data set, whether that's Echinococcus, hookworm resistance, or maybe even other parasites that aren't on the panel, perhaps parasites that, or drug resistance mechanisms that we haven't included yet? Or we talked about the Q134H marker being added that's not reflected in those earlier publications as it pertains to the multidrug resistant hookworm issue. So how do you imagine those findings will reshape guidelines, whether that's regarding antimicrobial or antiparasitic stewardship, the conversations that we're having with clients over the next decade? What does the future look like?
Yeah, I think it's really exciting because Christian Lutniger always says it best, which is you don't know what you don't know, right? And we have a wealth of information now that we can look at. I know I have some thoughts on some publications that I'd like to do next, and it's always hard. Like it's it's exciting, but it's also it can be a little overwhelming. Like, what do we focus on next? And we really try hard. I know I'm speaking for Christian when I say this as well. We try hard to listen to what general practitioners are telling us that they need information on, right? And so, when you ask me to talk about what's next, I guess what I would say very clearly is what's next is hopefully answering some of those key questions that veterinarians have asked us. And I think that's what you're going to see in 2026 is, okay, you wanted to know about, and here's your answer.
Well, I really, really appreciate you spending time with me today. We did a really nice deep dive here on all things KeyScreen research. Well, not everything, or we would have been here for 5 hours. But no, this was really enlightening, and I hope that our listening audience can really appreciate all the hard work that you've been putting into this, as well as all of our collaborators across Antech. So thanks for spending some time with us, Michelle. I hope that you'll be back with us soon.
It's my pleasure. Thanks for having me, guys.
Listen to new episodes of Tales from the Lab wherever you get your podcasts. And now you can also watch us on YouTube and Spotify.
Be sure to like and subscribe for exciting new content. Share new episodes with your colleagues and follow us on Instagram at Tales from the Lab. That's TAILS from the Lab. We're grateful you're here.